Have you ever wondered how the foster care system we know today came to be? Who was it initially intended to serve? How has that evolved to today? The modern foster care and child welfare systems tend to be associated with impoverished Black and Brown families. But let's take a step back. As we'll hear, the same families that were initially excluded from the system ended up being targeted by it just a few decades later. This is Among Us, a podcast from UCLA's Center for the Transformation of Schools that unpacks the often invisibilized experiences of students. On this episode, we start at the beginning, how foster care became established as an organized system. Our research director, Dr. Angela James, sits down with historian Catherine Rymph. Catherine gives us a condensed history lesson on child placement practices in the U.S. that begins with orphanages in the early 1900s and evolves into an organized public welfare framework funded by the federal government. Later on, Dr. James will speak with systems change leader Sixto Cancel. Sixto shares how his personal experiences with foster care and adoption fuel his current work to transform the system through his organization, Think of Us. Let's get started. Let's look at where we were as a country at the turn of the century. Foster care began as a patchwork of practices to care for impoverished and homeless children that included indenture, religious orphanages, and boarding out. In the early 20th century, with the rise of social work as a profession, child welfare professionals tried to formalize these systems and create standards of care. Foster care was actually regarded as a helpful service for families that had fallen upon hard times and was initially designed for primarily urban, northern white families who were unable to afford to take care of their children. The New Deal started to formalize the patchwork. New Deal programs were established to help the country recover economically from the Great Depression, and later reforms to those programs in the 1960s more closely intertwined foster care and child welfare aid money for poor families. At the same time, other policy changes resulted in more Black children entering foster care, creating a perfect storm for foster care to become synonymous in the public mind with the breakup of poor Black families. Dr. Catherine Rymph is the Dean of the University of Missouri Honors College and a 20th century U.S. historian who focuses on women's history and child welfare policy. Her book, Raising Government Children, A History of Foster Care and the American Welfare State, takes a deep dive into the beginnings of the foster care system as we know it today. Let's tune in to the conversation between Angela and Catherine.
Well, hello. I am so happy to meet you and to be able to start this podcast together with you. And I want to ask you to take us back to the origins of foster care. How was the system built?
Well, I think one place I would start there is with this word system, which is something that we think about a foster care system now. I would say that idea of a system really only dates to the early to mid 20th century. Before that, there was nothing you could really call a system. There were a lot of different practices for caring for what came to be called dependent children, impoverished children, poor children, homeless children, systems for caring for them that communities built up in different contexts. And, a lot of them were not terribly nurturing, right? So I would say it goes all the way back to systems of indenture, where an impoverished family that maybe had too many children to continue to be able to provide for might go into an indenture contract with someone where a younger child could learn a trade, right? That's a very different system than what we think of as foster care, but that would be one of the early systems that really goes back to the 17th, 18th century. But in the 19th century, you see the rise of orphanages. They originate as private enterprises, often associated with particular religious groups. But some states start setting up orphanages with public money. A lot of child welfare reformers thought orphanages were not good places for children, so they want to place dependent children in homes. And it's not until the early 20th century that, with the rise of social work, that you start to see child welfare professionals trying to formalize some of these systems and create standards of care. Because as you can imagine, all of these different ways for caring for children, and there's no licensure, there's no vetting homes before children are placed there. There's no follow-up. So child welfare reformers are trying to create a system and kind of bring all of those things under it.
Can you talk a bit more about the ways in which systemic and structural racism and gender ideology impact foster care and child welfare?
Going back to the 30s, 40s, 50s, the Black children were almost invisible to the foster care system. They were definitely underrepresented. And it can be kind of hard to wrap our brains around that. But in that mid-20th century period, the most optimistic versions of foster care was that it was a child welfare service. It was one that was helping families. And like many of the social services of the mid-20th century, they were really designed with white families, immigrant families, primarily in mind. A lot of that has to do with racism. It also has to do with the fact that those are programs that are targeting urban populations rather than rural populations, right?
That's what I was going to say. The focus on urban in and of itself. Exclusive of the experience and kind of what happens in the 50s and 60s. The Great Migration, right?
Right. And so the racial makeup of those urban areas in the north starts to change.
And I think that issue of volition and help are big parts of that, the origins with families themselves having strategies for seeking help that are coincident with this. That's very interesting. I read in numerous places your book references terms like hard to place and family pathology. What struck me was it kind of seemed almost deliberate, moving away from ideas about poverty and structural concerns and towards individualistic explanations for why children needed to be.
Yeah. I mean, I think if you accepted that the New Deal programs had solved the problem of poverty for most families, then people who worked in this field had to come to grips with the fact that there were still many, hundreds of thousands of children in foster care. And if you really believed that they weren't coming into foster care because of poverty anymore, then you had to look for other reasons. And the explanation that you start to see more and more in the 1950s is the children who are coming into foster care now are far more damaged than they were in the past, and that their families of origin are damaged, pathological. And there's almost this idea, a kind of nostalgia in a way, for an earlier time when children in foster care, these were basically normal children was the word that they would use. They were normal children whose family had just hit a rough patch.
Right.
And what they were seeing in the 1950s were children who were just far more damaged. They weren't normal.
Well, you also point out that Black families and children are largely ignored in the foster care system in the 50s, and how, of course, we see now they are quite overrepresented. Black and Indigenous children overrepresented in foster care. So can you talk a bit about the shift from being ignored to being overrepresented?
So when the Social Security Act was written in 1935, it sets up the Aid to Dependent Children program that assists single mothers in caring for their children. There is a tiny bit of money in the Social Security Act for other child welfare services, which included foster care. But that money was never allowed to be used to actually pay the board to the foster mothers. It could be used to kind of do staff development or training for social workers, but not to pay the foster mothers. And the reason for that was because so many of the foster agencies were sectarian. They were religious. And so there was the sense that public money should not be used to pay. It's a real hodgepodge of public and private. And you can't really separate them all very cleanly. So this was something that many experts continued to say, we need federal money for foster care because the local money and the state money is just not enough and the need is so high. We need more money. And this reform in 1962 to the Social Security Act, on the one hand, it was a very important reform to aid to dependent children because it forbade the states from passing so-called suitable home provisions. And it was the suitable home provisions that states were using to keep Black families off of ADC. Because if you can say, if this woman has a partner who she's not married to, or if she drinks alcohol on the weekends, or is running some kind of business out of her home that we don't approve of, then the agency that's vetting the family can say it's not a suitable home, so they're not eligible. And this was very problematic. It was a way that many families were kept out of that program. And so the reforms in 1962 end that. Can't do that anymore. That means more unmarried women and more Black women are going to be eligible for ADC for their children. So that's bringing more Black children into the ADC program.
Right.
So that's one thing. The other thing that the 1962 reform did was create a program called AFDC foster care. And so that was going to enable money that was going to AFDC to be used to pay board rates for foster children. So if a child was eligible for AFDC, had a single mother who met the income requirements, and that child was going to be placed in foster care, now federal money could pay for it. So this is where it gets really, really tricky. So it's great if you're someone who thinks we need more federal money to pay for foster care.
Right.
But what many of the experts saw was going to happen is that foster care was going to become ever more strongly identified as a poverty program.
Can we shift and talk a little bit about the degree to which foster care became more punitive and coercive? One of the things that was illuminated for me with your book was this discussion where we start with a time that this system emerges from very voluntary local programs where parents or a parent sought out support for themselves and for their children. And then the current system now, where this is kind of part of an apparatus that polices families.
I think some of that goes back to those 1962 Social Security Act reforms also, because with the new money for foster care for children who were eligible for AFDC came the concern that local agencies, they would say, if you apply for AFDC, we're going to put your children in foster care. So you better not apply for AFDC. So they add something to that, which is in order for a child to receive the federal money for foster care through AFDC foster care, there had to be a court determination of neglect.
Right.
So it's no longer voluntarily. And to be clear, the voluntarism of all of this
was always, quote
was
unquote,
not always all that voluntary.
Yes,
I mean, it's a kind of, depending on your circumstances, it could be pretty heavy-handed.
When you're poor and you need to have your kid not be with you and be somewhere else, that doesn't feel voluntary, I'm sure.
Doesn't feel voluntary, for sure.
But it is ostensibly different from the state coming and saying, you're not a good enough parent to parent this child.
Right. And it's basically necessary to get that particular kind of aid. And again, the advocates, the experts, and the child welfare reformers saw that this was going to be a really big problem because it was going to create, or exacerbate is probably a better word, the suspicion that families had towards the child welfare agencies and towards the courts, because there was just not really a possibility for it to be collaborative in the way that social workers envisioned it being, because the court is coming in and saying, you have neglected your child. That's what you need to do to get this service. And so if you add all those things together, larger numbers of Black children eligible for AFDC, now there's federal money through AFDC to pay for foster care for children eligible for AFDC, and those families have to be found to be neglectful of their children. I think you can see the beginnings of that more punitive form of foster care and a form of foster care that's more strongly associated with poverty at exactly the moment that more Black children are having access to the service of foster care, if you think of it that way.
What, from your perspective, are the highlights? What are the things that maybe we can use history to teach us that might help contemporary practices?
One of my takeaways from all of this, I mean, there has never been a time that people involved in this system thought it was a system that was really working to the benefit of children. It's always been criticized, even the people who were deep in it.
From the very beginning.
They were always trying to fix it. Anyone who has any interaction with foster care at all knows there are really bad actors in the system in all parts of it. But what I saw over and over again were genuinely good actors in all parts of the system that are so often pitted against each other, right? The state, the social workers, the birth parents, the foster parents are often end up in an antagonist relationship, understandably. But I really felt that I saw good actors in all parts of that. They're just working in a system that is inevitably tragic, because it's never a good situation when a child is being removed from their home. Even if it's absolutely necessary for the safety of the child, something has gone horribly wrong.
Right. Or not. I mean, sometimes something hasn't gone horribly wrong other than the determination that something has gone horribly wrong.
But that in and of itself is something that's gone horribly wrong, right? right. I mean, what's horribly wrong can take a lot of different forms.
Absolutely.
Right.
Absolutely.
And often what I saw was what's horribly wrong is social workers who do not have the cultural competency to understand the families that they're looking at, whether it's because of race, whether it's because of poverty, whether it's because of religion.
Or some combination of all of those things.
Or some combination of all of those.
Well, thank you so much.
Catherine just gave us a Foster Care History 101 lecture. Class is now adjourned. Coming up, a guest that moved through this system in a remarkable, often incomprehensible story that underlines his fire for transformation. Sixto Cancel is our guest. Coming up. Stick around. The UCLA Center for the Transformation of Schools partners with the education ecosystem to change school systems through research, practice, and policy to support more equitable outcomes for historically underserved students. We'd love to keep the conversation going with you. You can reach us at ctschools@ucla.edu. Among Us is sponsored by the Stewart Foundation, a family foundation dedicated to improving life outcomes for young people through education. CTS partners with amazing and vital organizations to promote change in our schools, like this one.
Hello, my name is Sandra Gaska, and I work at the Annie E. Casey Foundation as a Vice President of the Center for Systems Innovation. Thriving Families Safer Children is a national partnership that aims to support collaboration between young people, parents, and families who have experienced the child welfare system and system leaders to basically prevent them from even getting involved in the system to begin with. Families are being separated due to a lack of support within the system, and that needs to change. The support really has to be customized for families and built at that individual level with people within those communities. And only then can we create conditions for the strong, thriving families where young people are free from child welfare system involvement.
The Annie E. Casey Foundation is a financial supporter of the UCLA Center for the Transformation of Schools. A lot of families and young people fight to get out of the foster care system. Sixto Cancel had to fight his way to get placed back in. Sixto was placed in foster care as a baby when his birth mother was struggling with drug addiction. He was finally adopted at age 9, but was abused and called the N-word in his adopted home. Now, I wish I could tell you that I embellished the next part of the story, but I didn't. Sixto was watching a lot of Law and Order and learned from the show how important it is to have evidence for an investigation. So he decided to tape an audio recorder to his chest to record his abuse. He talks more about this in his TED Talk, which we'll link in the show notes. This taught Sixto the power of evidence, data, and research to change systems. Sixto went on to found and is now CEO of Think of Us, a research and design lab led by people with lived experience working to transform child welfare. Think of Us works in foster care research, program design, direct service, and policy, and has partnered with the White House through the past 3 presidential administrations. Sixto talks with Angela about some of the initiatives that Think of Us is undertaking, the role of schools in foster care, and the promise of kinship care, or placing a child with a relative. We turn now to Dr. Angela James's conversation with nationally recognized leader Sixto Cancel.
I am so pleased to welcome Sixto Cancel to our podcast today.
I'm just so excited to be here.
I would love for you to share with us, how does your own experience inform your work and how that informed the development of Think of Us?
Yeah, I think back to when I was 15, and that was the moment that I fell in love with a systems change. How do you actually, at the time, I would say improve the system, and now I err on the side of more transform the system. At 15, I had, experienced a merit of abuse. So I was adopted at the age of 9 after being in foster care since a baby. My adoption was very racist, very abusive. And so by 13, I found myself couch surfing. And it took me 2 years to get back into the system. I had to tape a recorder to my chest. I had to collect the evidence of what was happening to me, because what the world saw was this tallish looking black kid and this shortest looking white woman. And the assumptions were made that I was the problem. And so until I was able to collect the evidence, that is when I was able to come back into foster care. But it was so flabbergasting to me that here you have extreme removals happening to Black children every day. But in my case, I had to fight to get back in.
Wow. How did you come up with that idea?
Oh, I was watching Law and Order.
Law and Order.
So, yes, I was watching Law and Order, and I was like, oh, I get it now. I have to build a case, because the hotline and the investigators kept saying, your case is, not substantiated, unsubstantial. So then it would close. And so these investigations would open, close. And as a 13, 14-year-old, right, I experienced this as being called a liar.
Wow.
And so watching Law and Order and hearing cases and seeing some criminals get off because there wasn't enough of evidence, that's what taught me I really needed to value data and to value evidence.
I wonder if you could give our listeners, many of whom do not know very much about foster care, a brief overview of how the foster care system in the United States currently operates.
The foster care system today works in a way where there are 7 million children who are reported to the child abuse hotline. There are about 3 million investigations. And then a worker will decide whether you screen in or out a child into foster care. And then you have the journey of getting back home. Mm-hmm. And for some children, that means that your parent has done the parenting classes, abided with what the courts have actually required them to do, and then you get to go home. But for some other children, their parents' rights get terminated and they're up for adoption, or they become too old and then age out of the system.
Let me ask you this question. What can schools do?
Schools are one of the top 3 referrals to the child welfare system. And when we look at the 7 million children who are involved in a child abuse report, only 200,000 come into care. And what ends up happening is that there may be an investigation this year, and that child may not be put into the foster care system this year. But what we see is an overwhelming portion of those children coming back into the system 2-3 years later, because now the situation has gotten so chronic. And so there was a school in New York who had this abnormal high reporting to the child welfare system. And so the child welfare system reached out to them and said, hey, what's going on? Because not only are you reporting a lot, but you're also not having a lot of substantiated report. And so they worked together. And one of the solutions that came up was that the schools actually started to have a resource directory. So nothing fancy. And those calls dropped in the numbers that were being reported. Because at the end of the day, the problem is not that there are people out here who are willfully neglecting and abusing their children at mass, but that the mass is actually struggling so much with income, with mental health, with behaviors that that child may have, that they need support. And so the quicker that schools can deploy resources to the families that are in need, that is actually going to decrease the number of actual calls that the child welfare agency gets.
Can you talk a bit about the current realities of foster care system in transformation, what that transformation might look like?
I think we're living in one of the most exciting times in child welfare, because 10 years ago, the mandate of child welfare was that you either screen children into foster care or out to foster care, depending if there's abuse or neglect. You are mandated to reunify families. And if you can't do that, it's adoption, right? So there was this movement around permanency. When we look at the Obama administration, they passed legislation that centered well-being and centered the healthy development of a child, which meant like foster parents had more say over things like school trips and young people staying over and after school activities and more. And so what this did was it had to actually change government to behave in a new way to accommodate the healthy development of children in its care. Then we look at the Trump administration, and the Family First Act passed. And even though it may not be perfect, a new cultural shift happened, which was a mandate that now child welfare systems have the ability to actually serve families and young people as a prevention mechanism of coming into the system. So now all of a sudden you have a mandate to make sure people are well, that they're developing healthily, that they are, if you can prevent them from coming in by providing a service, that you're doing that. And then in this administration, another cultural shift and another mandate has been enabled, which is let's do our best to make sure that we are placing with extended families first, right? That's kinship care. And so we're living in this time where there are two new parts of the system that have to be implemented and built up, which is your prevention system and your kinship care system. If there's 200,000 young people who come into the foster care system every year, well, some are going to go into the prevention department. Some are going to go into the kinship department, which means that by default, if those two departments are adding more value, then by default, we see a decrease in traditional foster care. And to me, that is transformation. You are literally transitioning from one type of normal behavior as a system into another. And so people will have the arguments of improvement, reform, and abolition. I believe in the concrete theory of actually transitioning from one set of things to another.
I'm very interested in kinship care. Certainly have seen the statistics about outcomes for young people in kinship care versus traditional foster care circumstances. Can you talk a bit more about why that is such a transformation?
I mean, the reality is that we all want to be loved and we all want to belong. And I think when you are tossed into a system and you are living with unknown, unrelated people, it's very difficult to understand, are these people going to love me? Then you're in different homes and they tell you that they love you, but then if you don't fit in, if you act up too much, then your stuff is in a trash bag and it's on to the next home, right? And so I think that there is a power in attachment. There's a power in love and there's a power in connection. Yeah. And so when you have known someone, whether they're biologically related or you're attached to them because they have been an adult in your life for a very long time, there's a different commitment when stuff hits the fan. When your trauma is coming out and you have to struggle through the healing process as a teenager, those adults are committed to you. And we will always need people to foster who are unrelated, who are unknown, but we have an opportunity for the majority of our system to be placing children with someone that they know, love, and feel safe with.
Right. By policy.
Yes.
And I think that's an interesting notion as well, that as we change our policies to privilege that approach, that we may see different outcomes. And can you talk to our audience about the transformative impact of policy in this area?
Absolutely. Before I get to policy, I just want to even name some of the research, right? So right now, what we know is that a foster youth who has aged out experiences PTSD at 2 times the rate of an Iraq war veteran.
Wow.
Mm-hmm. When we look at the impacts of being placed with family, we know that there's less behavioral incidents. We know that there's less trauma that's being inflicted. And so research is clear that healing is different and that the additional ongoing trauma is not as severe as it is when you're placed in a foster home. In Allegheny County, a Second Chance, which is a provider, they are placing children with an extended family member. They actually have a very high rate of children graduating high school. Right now, what we know is less than 40% of kids who are in foster care with a group home experience are graduating high school on time.
Right.
When we look at the national average, 85%. But when we look at children who were placed in their kinship placements with extended family members, 95% graduation rate for the children who are in a Second Chance system.
That's amazing.
So what's revolutionary right now is that this administration has passed new regulation that enables states to do 2 things. Number 1, create a extended family specific process. So a kin specific process to be able to care for their relative's child. And so right now, becoming a foster parent takes months and months. Sometimes on the fast track is like 3-ish months, but we see a lot of states where the average is above 6 months. And so this allows extended family members to quickly be that home for their relative's child. And in addition, if you're following the national standards and you're actually, doing the work, then the federal government is matching money so that they can pay for the expenses that a state will have, like providing a monthly stipend, like being able to provide some case management and some other wraparound supports, right? And so the White House estimates that it is going to unlock about $3 billion over the next 10 years.
That's amazing. And I can imagine how important that is for families. No one anticipates a family member falling into that circumstance. So they didn't spend the previous 6 months or a quarter of a year preparing for it. So I can imagine how important the flexibility that you mentioned in policy. It's amazing to me that these policies came about. Can you talk a little bit about the work of Think of Us with regards to some of these policy changes?
Absolutely. We center everything that we do with people who have lived experience. And so when this administration came in, the associate commissioner wanted to make sure that she was centering lived experience. And so she asked for a group of young people who would advise her as she created her strategic plan. And so we put together a group of young people to do just that and to have those conversations. And she came to 4 strategic goals. When those rules came out, us and about 8 other organizations immediately reached out to all 50 states. And within 6 weeks, we were able to talk to about 46 states to, number 1, tell them, hey, what do these draft rules that are open for your commentary mean? What are the potential impact? What anxiety, what fears, what excites you? And this collective group of organizations did that work. And there was 167 comments that were submitted, and only 1 was on the negative side. The rest were positive. And now what we're doing is we are partnering again with these 8 organizations, and together we are drafting the national standards. From there, we will be able to go ahead and test, did we get it right with these standards? We always have unintended consequences when anyone is working with policy and practice. And so we want to make sure we're getting it right.
Absolutely. Thank you so much for sharing yourself with us. And I think that's a really good thing for us as we seek to make transformational change in policy, to stop being afraid that we know what is currently in place is not working. So stop being afraid and let's transform towards something that does work for children. I appreciate this conversation deeply.
Well, thank you so much for having me.
Sixto mentioned something that I want to highlight. Schools are one of the top 3 sources of referrals to the child welfare system. To decrease the amount of unsubstantiated reports to foster care, Sixto mentioned that a resource directory is a way that schools can refer families to access basic needs, mental health, and social services through community-based organizations or civic partners. This can be as simple as a list of resources posted on a school website or a printed flyer that could make a world of a difference for students and families who don't know where to access services or don't want to self-identify as being in need. The reality is that many families are silently struggling to keep up with bills, rent, childcare, and other responsibilities, especially in the wake of the pandemic. The more easily that families can access resources, the more likely that child welfare reports will decrease. Catherine briefly mentioned the need for cultural competency training for social workers and other frontline workers around things like race, class, culture, and religion. There may be misunderstandings or serious judgment errors because of something as simple as a language barrier, which can mean the difference between a child entering foster care or not. If practitioners are able to better understand the families they work with and have the appropriate training, tools, and resources to support them, we will see more trusting relationships between the system and families, and fewer instances of unnecessary reporting and placement into foster care. And that's one step in the right direction. This is Among Us. Thanks for listening. I'm your host, Geneva Sun. Among Us is a podcast by the Center for the Transformation of Schools in the School of Education and Information Studies at UCLA. Caitlin McAloon is the production coordinator. Elizabeth Wyndham is the supervising producer, and Julia Wyndham is the editor. The senior producer is Jay Woodward. Our theme music is Pillar by Shimmer. For more information about this week's episode, go to transformschools.ucla.edu. You can find all of our links in our show notes. If you have any questions or feedback for us, email us at ctschools@ucla.edu. And please follow, rate, and review on Apple Podcasts, Spotify, or YouTube. Among Us is produced by Windhaven Productions and Blue Jay Atlantic.